Welcome back to topic 3, consumerism. So what is consumerism? Again, it's one of these terms that we often band about, but we could really define it as the concept of an ever-expanding consumption of goods or services which are advantageous to the economy. So consumerism is essentially founded on capitalism and on the concept of continual market growth. Consumerism is also a feature of neoliberalism, which again relates to capitalism. And we have to, as I said in the last two topics, it's being facilitated by globalization processes. So in terms of consumerism and the economy then, globalization and particularly global competition have driven down prices, flooding markets with high turnover and relatively inexpensive goods and services. And this has led to a modern day obsession with stuff. You know, we all want stuff. So as a result of that, we've become a materialistic society, and that's had varied consequences for different groups of the population. However, it wasn't always like this. So historically, goods were made locally, they tended to be of high quality, wages were low, so people had to save to buy goods, and the cost of goods in relation to wages was quite high. The majority of household goods, for example, contained simple electronic or mechanical parts, which were easily fixed or repaired, and they were designed to last for many years. So consumerism didn't really start to take off until the post-war boom of the 1950s, when the economy had full employment, a thriving economy, which drove up wages. Consumerism, though, has taken a different turn today. So the introduction of new technology, particularly automation, and new production methods has increasingly driven down the price of consumer goods. And globalization processes have resulted in the consolidation of goods producers. So automation, although very cost effective, is very, very complex and expensive to set up. And so this has been part and parcel of the rise of the transnational corporation. And of course, these transnational corporations have benefited from cheaper labor costs, particularly in developing nations. Whereas I said before, you know, they can make have their R&D in one country, research and development in one country, and offset their manufacturing costs and lower them by outsourcing or manufacturing in lower labor cost countries. And in addition to this, complex electronics has increasingly become a feature of household goods in ways that it wasn't before. And because of this, there's built-in lifespans now, which ensure a continued demand. So consumerism only works if there's a continued demand for products. So our choices of goods and services are increasingly linked to individual identities. So at the cultural level, in some respects, we are what we buy. You know, these cultural values around individualism and materialism are a means by which we help to distinguish ourselves from others, and it helps distinguish our status. So, you know, many people, for example, queue for a new Apple iPhone, so on and so forth. Also, though, because of these values around individualism and consumerism, poor health has been deemed to be due to poor choices. And that's the culturally dominant view of why people have poor health. What this particular approach, this idea of consumerism and individualism doesn't recognize, though, is that there are the material and structural determinants of health. So, for example, although we have markets flooded with relatively cheap goods, these are only available to people who have the income to buy them. And unemployment and underemployment are a feature of globalization, as is a more casualized labor force. We also have more obesogenic environments. So we have mass availability of cheap, convenient foods, which are high in fat and sugar and not particularly nutritious. And also we have, we need education, if you like, to be able, quite a high degree of education, to be able to discern which products are healthy for us and are not. So in that sense, then, consumerism doesn't benefit everybody, neither does individualism. It benefits some parts of the population to the detriment of others. So essentially then, health consumerism are really services and goods available to promote health for a cost. They might include things like vitamins, health and fitness services, Fitbits, or even cosmetic procedures, because the appearance of health is becoming a more sought after benefit in society. So some of these products and services really have quite dubious health claims. Regardless, they're available to the people that can afford to have them. And consumerism and individualism have jointly fueled anxieties about health risks. So this has led to new advances and new services and products in health. So for example, now DNA testing can show you your predisposition to particularly life-threatening illnesses. And this has meant we've had the emergence of previvors like Angelina Jolie. So I don't know if you know, but Angelina Jolie ended up having a double mastectomy, not because she had breast cancer, but because she had a predisposition towards it. So she previved that particular issue. So we have this situation where on the one hand, we have a rationing of public health services, and on the other, we have increasing expenditure on health-related goods and services in the private sector. So let's look at consumerism and its implications for healthcare then. According to Latimer, consumerism is about offering patients choice and placing them at the centre of decision making. And it was essentially introduced into the healthcare sector in the 1980s and 90s. It's been championed by neoliberal governments, and it's been particularly championed because it's an effective way of dealing with rising healthcare costs. So healthcare rationing in public healthcare, as you know, if you go through the public system, you often have to be put on a waiting list for particular surgeries or treatment, is incompatible with consumerism because there's no choice. You don't get to choose who operates on you and so on and so forth. And the argument is that healthcare can be provided more efficiently in the private sector. Secondly, empowered patients are therefore encouraged to seek to fulfill their needs in this private sector, and that has the effect of shifting costs from a centrally controlled tax-funded public sector increasingly to the individual. As we all know, there's always gaps. Even if you have private health insurance, there's always some gaps to pay when you consume a health product or service. So in summary then, consumerism champions an individual's right to choose health and healthcare services and products, and it does so by citing this rational economic perspective. You know, the private sector can provide health much more cost effectively than the public sector. It's that that old argument of supply and demand that we've seen last week when we looked at the economic perspective. Consumerism has also placed increasing responsibility, therefore, for health with the individual, and this has legitimated and increased the role of private healthcare and commercial healthcare products and services. So we're increasingly moving to a user-pay system, which, as I said, promotes supply and demand economics. But on the other side, consumerism and individualism ignore the structural barriers and material means necessary for health. And this has particular implications for some sections of the population who might lack the cultural and economic capital to achieve health. So the know-how, the technical know-how to know what's healthy and what's not healthy and how to behave in a healthy way, or even the capital and resources to purchase health products and services. And this also has implication to the access to healthcare resources as a whole. So essentially, consumerism and individualism create a dichotomy in health. And it essentially means we're faced with a spectrum where on the one hand, we have an individual's right to choose, individualism, versus an individual's right to health, which is about equity. So what I'm going to leave you with is thinking about health as a holistic concept. Has Australia achieved the right balance between a right to choose versus a right to health? We'll discuss this more in our tutorials next week. Okay, thank you. Bye-bye.